Hello, and thank you for watching A Better Approach to Parkinson's. I am Robin Fossey, your host and Executive Director of the NeuroChallenge Foundation for Parkinson's. A Better Approach to Parkinson's is a monthly educational program about a variety of topics that are important to the Parkinson's community. To kick off the A Better Approach to Parkinson's series, today's topic is Parkinson's 101. In future programs, we will address the non-motor symptoms of Parkinson's, the effects of diet and exercise on the disease, addiction and other challenges, support for caregivers, and much more. We are grateful to Manatee Educational Television for partnering with the NeuroChallenge Foundation for Parkinson's to bring you this very important program that will present you with information that will help you live well with Parkinson's disease today. Speaking of today, I would like to introduce today's guest, Dr. Deborah Burke. Dr. Burke is a board-certified neurologist and fellowship-trained movement disorder specialist. She sees patients at the Ross Camp Institute here in Manatee County and at University of South Florida's Parkinson's Clinic in Tampa. Dr. Burke received her medical doctorate from Boston University School of Medicine and also completed a master's in education from Northeastern University. Dr. Burke did her internship, neurology residency, and movement disorder fellowship at the University of South Florida. Dr. Burke is also a member of the NeuroChallenge Foundation's Medical Advisory Committee. We are so fortunate to have Dr. Burke as our very first guest of A Better Approach to Parkinson's. Welcome, Dr. Burke.
Well, I'm glad to be here.
I'm so happy that you're here. So let's just start off with what is Parkinson's disease?
Parkinson's disease is a progressive, degenerative disease of the central nervous system, actually the whole nervous system, but most noticeably or recognizably the central nervous system. I mention that because it's actually thought that Parkinson's disease begins probably decades before it's recognized. When it is recognized, it has affected a part of the brain called the basal ganglia that is deep in the brain above the brain stem, and it is responsible for the control of movement. One of its tools is a chemical messenger or neurotransmitter called dopamine. As part of the disease, proteins that develop abnormally, they're called alpha-synuclein, become sticky, they get in clumps, and they get deposited in the brain, causing the problems. When people are first diagnosed, not necessarily when they first start developing the disease, but when they are first diagnosed, it is often because they have a tremor, slow movements, rigidity. Now, these symptoms are present in a somewhat unique way in that the slowness and stiffness do not necessarily look like arthritis. So many things could cause someone to look slow, a bad knee. But this has a unique kind of diffuse presence. It's not specific to a limb or a sore joint. Slowness and stiffness might present even with a decreased facial expression, a lack of blinking or at least decreased blinking. People might have a very soft voice and are frequently asked to speak up. They may develop very small handwriting that starts this normally and becomes littler and littler. The typical or classic tremor in Parkinson's is a rest tremor. So you don't get the tremor like sitting here and then go and then tremor. That's an action tremor. A rest tremor is when you're at rest, maybe paying no attention, and the hand starts to go. And the spouse goes, "What's that?" And you go, "Huh? I don't know what you're talking about." It's slow and a higher amplitude than some other kinds of tremor.
So what are some of the other symptoms of Parkinson's disease?
Well, yes, not all symptoms come from the problems in this part of the brain. Parkinson's disease is actually larger than that. It affects other systems in the body, including something called the autonomic nervous system. This controls somewhat vegetative functions. For example, blood pressure may become uncontrolled. More commonly and earlier in the disease, maybe even decades before the disease, you might see constipation. You might see, now what am I thinking? Some memory and thinking changes are symptoms. Now at the beginning, you don't necessarily see dementia, but slower thinking, difficulty with multitasking. People may have trouble with their bladder. People may have trouble with balance. And these symptoms are not a result of the depletion of the neurotransmitter dopamine. They're involved, as I said, with other systems involving usually something like norepinephrine or epinephrine, other chemicals.
So how is Parkinson's disease treated?
The mainstay of treating Parkinson's disease is an old medicine that discovered over half a century ago. It's called levodopa, carbidopa-levodopa, or the brand name that's frequently recognized as Sinemet. The levodopa, sometimes called L-dopa, is a precursor. It's an amino acid that the body will turn into dopamine. We make levodopa out of proteins in a healthy body. The levodopa that people take via a medication follows the same path. It goes in through the GI system, it goes into the bloodstream, crosses the blood-brain barrier, and the natural enzymes in the brain make the dopamine out of the levodopa medicine, just like our body naturally makes levodopa. So it's very powerful. It's very close to a natural, it's not a substitute, it's the real thing. There are other adjunct medications. Some of them are synthetic molecules that look like dopamine and can affect the receptors. And then there's a whole pharmacopoeia of medications that are symptom-oriented. They don't address the core deficit of dopamine. They may be sleeping pills for insomnia, another symptom of Parkinson's, sleep disturbance. They may be slightly stimulating for fatigue. They may inhibit urination if people have frequency. Maybe for constipation, depression. Depression is another non-motor symptom of Parkinson's. And that's another symptom that may begin decades before the disease presents.
So in discussing the medications for treating many of the symptoms associated with Parkinson's, is there a cure for the disease?
As yet, there is not a cure. We don't have tools to turn the clock back or to even stop or slow the disease. But there's a great deal of interest in this, as you can well imagine.
Yes.
Yeah.
So how many people do you estimate have Parkinson's disease in the United States and then worldwide?
Approximately 1 million, roughly, in the United States, maybe 7 to 10 million worldwide. About 60,000 people are diagnosed each year, and the average age of diagnosis is about 60, much smaller percentage below 50.
So one question I am asked frequently by people who are concerned about developing Parkinson's is Parkinson's disease genetic?
It's a very interesting subject because it's a little murky. Yes, in the sense that there are a number of genes associated with Parkinson's disease. Many people who develop the disease, however, don't have any of those genes. And there are people that have one or another of those genes and may never develop the disease. There is at least one gene that is pretty effective, if you want to use that word. It's associated with young onset Parkinson's. And in those families, it's pretty recognizable as genetic because so many people will develop the disease. But so the thinking is that genes may make a person more vulnerable to developing Parkinson's. It may be that you need a certain combination of genes, and most likely some kind of environmental trigger, some exposure.
So that leads me to another question that you touched on when you talked about young onset. I know I personally have met someone who was in their 20s when they were diagnosed with Parkinson's. So are you seeing an increase in cases of young onset?
You know, that's a hard question to answer. For my own population, maybe a little, but I'd have to stand back and look at some more statistics. I wouldn't say so from simply the population that I see.
Well, especially here in our community where we have more of an aging and retirement community.
Yes.
So are there any risk factors that contribute to someone developing Parkinson's disease?
Well, we mentioned the genetic vulnerabilities. There are some associations with toxins, Agent Orange, and I think recently, and I can't be specific about what toxins are involved, but people that were at Camp Lejeune, the VA has recognized that exposure as a risk factor for Parkinson's disease. There's been some attempt to associate other qualities, personalities, but I don't see that as very robust, those kinds of associations. There is some interesting data about the reverse. In other words, people that drink a good amount of coffee or even use tobacco have a decreased risk. Now, of course, that doesn't mean we should all go smoking. There's other ways to stimulate those nicotine receptors, but scientists and researchers are looking into those sort of excitatory chemicals as possibly being neuroprotective in some way. Healthy living may be protective. It's certainly things like exercise help even after the disease has begun. So one would intuit that it's probably very beneficial.
And am I correct in understanding or stating that exercise can actually help to slow the progression of Parkinson's disease?
There are some indicators of that. I mean, it's still being researched, but there are some indicators that may be true, yes.
Well, that's good news for people here in our community because there are a variety of resources that are available, and NeuroChallenge Foundation is very happy to work with various fitness experts in our community to help connect people with Parkinson's to those resources. So is there any way to prevent it, a surefire way to prevent or avoid Parkinson's disease?
Unfortunately, no. We don't know of any way to guarantee that you won't get the disease. If you were working in a occupation where there's a lot of chemical exposure, you'd be sure to use your protection, for example. Sure. But in terms of an absolute wall, I don't know of any.
And you mentioned earlier about Camp Lejeune and military servicemen or women, and so with the VA recognizing now Parkinson's as a diagnosed disability, if anyone is listening to this program that served in Vietnam or had those exposures, they can contact their local Veteran Services offices to determine if they have access to benefits.
Absolutely, because if they do, if they do develop Parkinson's, it is, as I understand it, a presumed association, and they will find the benefits very useful.
So if someone at home is watching this program and they think they may have Parkinson's, or they think their spouse or a loved one may have the disease, what should they do?
Well, the simple answer is talk to their primary care doctor, and sort of itemize what why they think that. You know, we don't think of this much, but if you're wondering what, for example, a Parkinson's tremor looks like, or the gait of a Parkinson's person, you can see it on YouTube, you know? So people who are, you know, have a little shake and maybe they don't want to go to the doctor, you know, although I would recommend that. I would recommend going to the doctor. And their doctor may be experienced in Parkinson's and be very capable of either assuring them that really is not like a Parkinson's symptom, or is fairly certain they do have it. Or they might send them to a neurologist. Of course, we recommend that. If they don't feel that they're taken seriously, you know, they can also seek out a neurologist. Many people on their own.
So if someone, one of the stories that we hear frequently at NeuroChallenge Foundation is that a person with Parkinson's may have had to see several doctors to be properly diagnosed. And one thing here in Manatee and Sarasota County, we are very fortunate to have such a great community of neurologists and movement disorder specialists like
there are
yourself.
many good people here.
And so what would be your advice to a person who maybe was told by their primary care or by another doctor that they don't have Parkinson's, but they just feel something is not right? What would you suggest perhaps as a next step? Maybe a second opinion? What does that look like?
Well, absolutely a second opinion, and that happens quite often. Maybe do a little research, you know, find a doctor that has experience with Parkinson's. As I mentioned, symptoms like slowness, stiffness, they're vague if you haven't seen what Parkinson's slowness looks like. It's also referred to as bradykinesia, slow movement. It's got a certain quality. So by going to a neurologist that has experience with Parkinson's, they know the walk. There's a walk. People often might not swing one arm. They know the look. There's a look. What we call decreased facial expression. When you see it, it's very recognizable if you've seen it quite a bit. Even now, some things almost anybody could recognize if they paid attention. That handwriting, it's very distinct to Parkinson's. People will start out with their regular, and it'll just go right down, smaller and smaller and smaller. So I would say, and then, you know, people nowadays, they Google people and look for reviews, somebody that'll pay attention and, you know, shows an interest in them.
So one of the things that we always like to bring attention to is the caregiver of a person with Parkinson's, and I know you and I have had conversations with, you know, regarding the fact that Parkinson's disease is really not just a disease of one person. It is a disease that an entire family takes on.
Absolutely.
And so what are some of the things that you see with your patients when it comes to their caregivers, whether it be a spouse or a child? What are some of the, I guess, effects that for them?
Well, the caregivers, of course, are worried. They have a need for knowledge just as much as the patient. You know, what does this mean? What's going to happen to my parent or my spouse? Now, of course, it changes with the stage. You know, how much care is the person going to need? How physically incapacitated are they? Where do you get help? What about the financial future? How can they help? Sometimes kids come in from out of town and they have jobs and families someplace else, so what are they going to do? some of the caregivers, and this is a tough one, some of them, the patient and the caregiver are elderly, and the caregiver has their own medical problems. Sometimes neither one of them drives. And so they have a need for a lot of services. You know, I strongly recommend they reach out to support groups, to organizations like yours, to any place that can hook them up with different, because doctors can't provide everything in an office visit. And people need services. And where do you find a good physical therapist? Where can I find a good Parkinson's exercise group? Because after a while, you may not be able to just jump in at the aerobics class at the Y.
Sure.
So they need this kind of support. They need information.
So that leads me into another question. You have touched on some of this already. Other than seeking care from a neurologist or a medical professional, and other than getting medication situated and squared away, what are other activities that you recommend for the person with Parkinson's, and then also perhaps for their caregiver?
Well, a lot of this could apply to both, but for the person with Parkinson's, exercise. And I'm not saying you kill yourself or become obsessive, but simply very committed to exercise. One of the symptoms that I see changes the quality of life fastest is the loss of balance. And most of our interventions, our medicine interventions, don't help balance. So right from the get-go, even if someone has perfect balance, I really try to talk them into something like Tai Chi, yoga, rock steady boxing, which is non-contact kind of boxing, but it takes advantage of the fact that a good boxer has balance and grace. It isn't about, contact. And then there's diet, of course. I tend to talk to people about something called the Mediterranean diet, which isn't specifically for Parkinson's, but is recognized more and more as offering many health benefits: vegetables, whole grains, fruits, seafood over red meat. Not too many carbohydrates, and those should be complex. You can have your glass of wine.
Well, that's good.
Well, it isn't an ascetic diet. It isn't a diet of deprivation. There's nuts, seeds, avocados, oils, but stay away from saturated fats. But this is what's being promoted more and more, even for cardiac health, for everybody. I don't know of a specific one for Parkinson's. And then use groups like NeuroChallenge for more professional, as well. You do both, but to find a good physical therapist or a good speech therapist. Big and Loud are therapy programs very specifically for Parkinson's. Parkinson's patients move small, they pull in. So there's therapies: move out, move big, speak loud, speak up. This is different than traditional speech therapy or physical therapy for a stroke, say, or a hip replacement. So people need ways of, and now when it comes to therapists, physicians might already know who to refer to, but not always. Or maybe it isn't a good match. Sometimes people need help with things like, I had a patient today, I want to connect them with services. Neither one of them drive. They're at home alone. Neither one of them drives. I told them to call you.
Well, thank you, because that's exactly what we can do, is we can help connect them to resources that can help them get to the therapies and the treatments, but also to identify therapy and treatment programs that are more conveniently located for them and where they live. And so I appreciate that, because it certainly does take a community. I just want to wrap up. If there's anyone watching and they have Parkinson's disease, and sometimes there are so many challenges that go with the disease, what would be your parting words for anyone watching today?
Focus on living your life. Live life. Take care of the problems that interfere with doing that. If you're blue and sad all the time, don't be afraid to take an antidepressant. Don't be afraid to go talk to somebody. If you need help getting strong enough to do things, if you have problems with fatigue and sleep, deal with them. But then enjoy life. Go out. If it's hard to make friends, join a support group. Have fun. And enjoy your life, because you're going to have a lot of it.
Well, Dr. Burke, I want to personally thank you, not just for being here today, but for the care that you give the Parkinson's community. We have many people who participate in our programs who are your patients. They think
Good.
very highly of you, and
Thank you.
I appreciate you for having that patient-centered approach. We're very fortunate in our community to have you and many of your colleagues.
Thank you so much.
You are very, very welcome, and thank you again for being here today.
Okay.
And thank you for joining us today. I hope the information discussed here was helpful in navigating your journey with Parkinson's disease. Many of the activities Dr. Burke recommends for people with PD are available to you through the Neuro Challenge Foundation, all at no charge. Education and information are essential to successfully navigate the challenges of Parkinson's. We have an upcoming educational event that I am excited to share with you, and I want to invite you to the Manatee Distinguished Speakers event, featuring Dr. Jeffrey Cameron from Health South Rehabilitation Hospital. Dr. Cameron will discuss the role of diet in preserving brain function and slowing the progression of Parkinson's disease. The event will also include a presentation about understanding how to respond to emergency situations in your home from Jimmy Crutchfield, the Chief of Manatee County Paramedicine. The Distinguished Speakers event will be held Saturday, November 4th, beginning at 10 a.m. at the State College of Florida's Neal Performing Arts Hall. Like all of Neuro Challenge's programs and services, this educational event is provided to you at no charge. To RSVP for the Distinguished Speakers event, or for more information about support groups and educational programs in Manatee, Sarasota, Pinellas, or Charlotte counties, please visit us at neurochallenge.org or call us at 941-926-6413. Thank you again for joining us for A Better Approach to Parkinson's. I look forward to seeing you here again next month.